Vasculitis, manifestations and therapeutic approaches. Vasculitis, also known as angiitis or arteritis, constitutes an autoimmune malady affecting blood vessels, organs, and tissues. The condition induces swelling and constriction of vessels, impeding the smooth flow of blood to various tissues and organs. In severe cases, vessels may even close entirely, leading to potential damage in affected areas. The manifestations of vasculitis are diverse, contingent on the specific body part impacted. Common symptoms encompass fever, weight loss, fatigue, headache, and generalized aches. Specific manifestations include ocular symptoms, skin abnormalities, neurological issues, cardiovascular complications, renal involvement, gastrointestinal symptoms, ear-related problems, extremity afflictions, respiratory distress, genital ulcers, nasal symptoms, and oral manifestations. Classification of vasculitis. Vasculitis is a broad term encompassing several conditions marked by blood vessel inflammation. Categorization is based on the size of involved blood vessels. Types include systemic vasculitis, characterized by inflammation of blood vessel walls throughout the body. Exercise-induced vasculitis, a small vessel variant occurring predominantly in women over 50. Triggered by intense exercise, manifesting as leg rashes. Urticarial vasculitis, affecting small skin blood vessels, leading to itchy patches, hives, and potential damage to other organs. Leukocytoclastic vasculitis, inflammation due to immune cell waste, causing skin lesions. Typically on the legs, and potential organ involvement. Oncovasculitis, targets specific white blood cells, resulting in swollen and inflamed blood vessels throughout the body. Egavasculitis, most common in children, causing skin, joint, intestinal, and kidney inflammation. Often presenting as a raised skin rash. Cutaneous vasculitis, inflammation and damage to skin blood vessels. A prevalent form among diagnosed cases. Central nervous system, CNS, vasculitis, inflammation of blood vessel walls in the brain and spine. Treatable but serious. Rheumatoid vasculitis, arising as a complication of rheumatoid arthritis, involving inflammation. ND, narrowing of small to medium-sized blood vessels. Other types include giant cell arteritis, polyarteritis nodosa, Takayasu arteritis, Behçet's disease, and Kawasaki disease. Causes of vasculitis. The origins of vasculitis, a multifaceted autoimmune disorder, pose a considerable challenge to researchers and medical practitioners. Despite extensive investigations, the exact etiology remains elusive. However, several potential triggers have been identified, shedding light on the intricate interplay of genetic, immunologic, and environmental factors that contribute to the development of this condition. Autoimmune diseases. Autoimmune diseases, characterized by the immune system mistakenly attacking the body's own tissues, are implicated as significant contributors to the onset of vasculitis. Rheumatoid arthritis, RA, and lupus are among the autoimmune disorders frequently associated with vasculitis. In these conditions, the immune system's aberrant response can lead to inflammation of blood vessel walls, initiating the cascade of events that characterize vasculitic diseases. Infections, particularly those caused by certain viruses, have been identified as potential instigators of vasculitis. Hepatitis B and C infections, in particular, have been linked to an unusual immune system reaction that triggers inflammation, damaging blood vessels in the process. The intricate relationship between viral infections and the immune system may serve as a catalyst for the development of vasculitis in susceptible individuals. Allergic reactions to medications. Another noteworthy factor in the genesis of vasculitis is allergic reactions to medications. Certain drugs can elicit an immune response that, in some cases, results in inflammation of blood vessels. Understanding and monitoring potential adverse reactions to medications is crucial in the management of patients at risk for vasculitis, especially when treating underlying conditions with medications known to provoke immune responses. Blood cancers. The association between vasculitis and specific blood cancers, such as leukemia and lymphoma, underscores the intricate connection between hematologic malignancies and vascular health. The abnormal proliferation of immune cells in these cancers, coupled with the release of inflammatory mediators, can lead to vascular inflammation and compromise the integrity of blood vessels. Other potential triggers. While autoimmune diseases, infections, and blood cancers represent prominent triggers, it's essential to acknowledge that vasculitis may also be influenced by a combination of genetic predisposition and environmental factors. The interplay of these elements creates a complex landscape, making it challenging to pinpoint a singular cause for the diverse manifestations of vasculitic diseases. Risk factors for vasculitis. The propensity to develop vasculitis is influenced by a myriad of factors, reflecting the intricate interplay of genetics, lifestyle, and environmental elements. Recognizing these risk factors is crucial for both early detection and comprehensive management of vasculitic conditions. Key contributors to the likelihood of developing vasculitis include age. Age stands out as a significant factor, with certain types of vasculitis demonstrating a predilection for specific age groups. While the condition can affect individuals at any age, some variants are more commonly diagnosed in older individuals, underscoring the importance of age as a consideration in the diagnostic process. Family history. A familial predisposition to vasculitis can elevate the risk for affected individuals. Genetic factors play a role in susceptibility to autoimmune disorders, and a family history of vasculitis may indicate an increased likelihood of developing the condition. Understanding familial connections is vital in assessing an individual's risk profile. Cocaine use. Substance abuse, particularly the use of cocaine, has been identified as a potential risk factor for vasculitis. The vasoconstrictive properties of cocaine can adversely affect blood vessels, contributing to inflammation and vascular damage. Substance abuse screening and intervention are integral components in managing vasculitis risk. Smoking. Cigarette smoking is recognized as a modifiable risk factor for vasculitis. The harmful components of tobacco smoke can trigger inflammation and compromise vascular health, making smokers more susceptible to the development or exacerbation of vasculitic conditions. Smoking cessation initiatives play a crucial role in mitigating this risk. Specific medications. Certain medications have been associated with an increased risk of vasculitis. Examples include allopurinol, xyloprim, hydralazine, apresilene, minocycline, dinosine, minosin, Myric, Solidin, Xamino, and propylthiouracil. Awareness of medication-related risk factors is vital for both prescribing physicians and patients, ensuring informed decision-making in the context of overall health. Infections. Infections, particularly viral ones, can serve as triggers for vasculitis. Notable examples include COVID-19, hepatitis A, and hepatitis B. The immune system's response to these infections may lead to aberrant inflammatory reactions affecting blood vessels. Vigilance in monitoring and managing infections is paramount in reducing vasculitis risk. Other immune disorders. Individuals with pre-existing autoimmune or immune disorders may face an increased risk of developing vasculitis. Conditions such as rheumatoid arthritis, lupus, or Sjögren's syndrome can contribute to a dysregulated immune response, potentially leading to vascular inflammation. Gender. Some forms of vasculitis exhibit gender-specific predilections. Understanding these gender-based patterns is crucial for clinicians, as it can influence both the diagnostic approach and the tailored management of vasculitic conditions. Epidemiology. Vasculitis, a complex and diverse group of disorders characterized by inflammation of blood vessels, emerges as a rare condition within the medical landscape. The incidence of vasculitis is notably low, with fewer than 50 reported cases per million individuals annually in the United States. This rarity contributes to the challenges in its diagnosis, requiring a heightened clinical awareness to ensure timely recognition and intervention. Age serves as a noteworthy demographic factor in the epidemiology of vasculitis. While the condition can manifest at any age, there is a discernible increase in incidence with advancing years. Specifically, there is a higher prevalence of vasculitis in individuals aged 50 and older. This age-related trend underscores the importance of considering age as a relevant parameter in the diagnostic evaluation of patients presenting with symptoms suggestive of vasculitis. Despite the increased likelihood in the older population, the overall probability of an individual developing vasculitis remains low. With fewer than 50 cases per million individuals each year, vasculitis retains its status as an infrequent occurrence within the broader spectrum of medical conditions. This rarity emphasizes the need for healthcare practitioners to maintain a vigilant and informed approach, ensuring that potential cases are not overlooked or misdiagnosed. Understanding the epidemiological nuances of vasculitis, including its rarity and age-related patterns, facilitates a more targeted and effective approach to its diagnosis and management. Ongoing research endeavors aimed at unraveling the intricate factors contributing to vasculitis incidence hold promise for advancing our understanding of this complex group of disorders, ultimately fostering improved strategies for early detection and personalized care. Diagnosis. Accurately diagnosing vasculitis requires a thorough and comprehensive approach, encompassing various elements to ensure a precise understanding of the condition. The diagnostic process involves a combination of medical history. Gathering a detailed medical history is the initial step in assessing potential vasculitis. Understanding a patient's medical background, including prior illnesses, medications, and familial medical history, provides essential context for the diagnostic evaluation. Physical examination. A meticulous physical examination is conducted to identify clinical manifestations indicative of vasculitis. Physicians closely observe for specific signs and symptoms, such as skin abnormalities, joint pain, neurological deficits, or other organ-specific manifestations, which may point towards vascular inflammation. Blood tests. Various blood tests are employed to assess markers indicative of inflammation, immune system activity, and organ function. Elevated levels of certain antibodies or abnormal blood cell counts may suggest the presence of vasculitis or contribute to a differential diagnosis. Urine analysis. Urine analysis is performed to evaluate kidney function and detect signs of kidney involvement, a common complication in vasculitis. Abnormalities in urine, such as the presence of blood or protein, may signal renal inflammation. Imaging studies. Utilizing advanced imaging techniques is integral to the diagnostic process. X-rays, magnetic resonance imaging, MRI, computed tomography, CT, scans, positron emission tomography, PET, scans, ultrasounds, and angiograms are employed to visualize blood vessels, organs, and tissues. These imaging studies aid in identifying areas of inflammation or damage. Heart tests. Echocardiogram, echocardiography, or an echocardiogram, is conducted to assess the structure and function of the heart. This test helps identify potential cardiovascular complications associated with vasculitis, such as inflammation affecting the heart or blood vessels. Biopsy. In certain cases, a biopsy of affected tissues is deemed necessary for a definitive diagnosis. Tissue samples, often obtained from the skin, kidneys, or other affected organs, undergo microscopic examination to reveal characteristic patterns of inflammation or damage consistent with vasculitis. The integration of these diagnostic components allows healthcare professionals to formulate a comprehensive understanding of the nature and extent of vasculitis in an individual patient. The diagnostic journey often involves collaboration among various specialists, including rheumatologists, nephrologists, dermatologists, and radiologists, to ensure a thorough and accurate assessment. Given the complexity of vasculitis and the diverse ways it can manifest, a meticulous and multidisciplinary diagnostic approach is crucial. Early and precise diagnosis lays the foundation for timely intervention and the development of an effective treatment plan tailored to the specific characteristics of the vasculitic disorder in each patient. Treatment approaches. Steroids, for example, prednisone. Steroids, particularly prednisone, are frequently prescribed as the cornerstone of vasculitis treatment. These anti-inflammatory medications work to suppress the immune response, mitigating inflammation in blood vessels. However, long-term use necessitates vigilant monitoring for potential side effects, including high blood pressure, elevated blood sugar levels, and bone issues. Immunosuppressive medications, depending on the severity and extent of organ involvement. Additional immunosuppressive medications may be incorporated into the treatment regimen. These drugs aim to modulate the immune system and reduce inflammation. Commonly used immunosuppressive agents include azathioprine, cyclophosphamide, methotrexate, mycophenolate, rituximab, tocilizumab. The selection of a specific medication is determined by factors such as the type of vasculitis, the organs affected, and the patient's medical history. Regular monitoring is essential to assess the medication's effectiveness and manage potential side effects. Surgical interventions. In cases where vasculitis leads to complications requiring mechanical intervention, surgical procedures may be necessary. Examples include repairing blood vessels affected by aneurysms or restoring blood flow in the case of blocked arteries. Surgery becomes a crucial component when organ damage necessitates direct repair or removal. Ongoing monitoring and adjustments. Continuous monitoring of the patient's response to treatment is paramount. Adjustments to the medication regimen may be required based on disease progression, the emergence of side effects, or changes in the patient's overall health status. Regular follow-up visits with healthcare providers, including rheumatologists and other specialists, are integral to the ongoing management of vasculitis. Supportive therapies. alongside specific medications, supportive therapies play a vital role in managing vasculitis. These may include pain management, physical therapy, and lifestyle modifications. Exercise and a balanced diet contribute to overall well-being and can help mitigate side effects associated with medications. Complications. Complications of vasculitis include organ damage, blood clots, aneurysms, loss of eyesight, and infections. Prognosis. While vasculitis lacks a cure, appropriate treatment can afford a long and active life. The prognosis depends on factors such as the specific type, promptness of diagnosis, severity of organ involvement, and coexisting health conditions. Most forms of vasculitis are chronic, but successful treatment can induce extended periods of symptom remission. Living with vasculitis. Managing vasculitis involves addressing medication side effects. Patients are encouraged to comprehend the disease, adhere to treatment plans, engage in regular exercise, adopt a healthy diet. Keep vaccinations up to date, seek support from family or support groups, and consult mental health professionals when needed. In summary, vasculitis, an autoimmune disorder affecting blood vessels, poses diverse challenges. Its varied symptoms, categorized types, and elusive causes make diagnosis intricate. Triggered by factors like autoimmune diseases, infections, and medication reactions. Vasculitis requires careful consideration of risk factors, especially in individuals over 50. Diagnosis involves a comprehensive approach, integrating medical history, examinations, and various tests. Therapeutic strategies encompass steroids, immunosuppressive drugs, surgery, and continuous monitoring. Complications highlight the severity, but with appropriate treatment, individuals can lead fulfilling lives, often experiencing symptom remission. Living with vasculitis demands a holistic approach, emphasizing awareness, adherence to treatments, healthy lifestyle choices, and robust support networks. As research continues, there's optimism for improved diagnostics and treatments, offering hope for better outcomes in the journey of those facing vasculitis complexities. Your health matters. Quali.Health